Thank you, Chair Rogers, for holding this hearing and allowing me to testify in support of the Safe Patient Care Act. And thank you, committee members, for your time today. I also want to thank the sponsors of this important package for all their support in bringing it forward. My name is Jamie Brown. I'm a critical care registered nurse at a West Michigan hospital with over 20 years of experience and president of the Michigan Nurses Association. The issues we're talking about today are not just important to our members, they're also urgent to tens of thousands of other Michigan nurses, both in unions and not, as well as to countless patients and their families. 93% of Michigan RNs polled support passing the Safe Patient Care Act, and a majority of them say they would return to or stay in direct patient care if it passes. Research from Dr. Linda Aiken and other experts have shown that hospitals can save lives and save money by following safe patient nurse to patient ratios. We understand the need to look at all possible solutions to solving this crisis, but a supply-only approach will not work. According to the study this year by U of M professor Christopher Fries and others, 39% of Michigan nurses plan to leave their job in the next year. This increases to nearly 60% for younger nurses. We have a leaky bucket. No matter how many nurses we graduate or bring in, nothing will change unless we address hospital working conditions. In the meantime, there is a related patient safety crisis in our hospitals. According to a poll done this year, 42% of Michigan nurses know of a patient dying due to nurse understaffing. That's nearly double from 2016, when it was 22%. There are also other preventable adverse outcomes such as falls and hospital-acquired infections that cost the hospitals hundreds of thousands of dollars each year. There is a growing understanding that laws requiring safe patient care assignments are needed. In fact, the American Nurses Association for the first time recently expressed support for federal legislation setting nurse-to-patient ratios. We want Michigan to be a leader and a place where nurses want to work. The Safe Patient Care Act will make that a reality more than any other intervention. I'd like to conclude by sharing some words from a fellow critical care nurse named Brindy. It is not fair that people live or die because of short staffing. I have been forced into unimaginable life or death circumstances countless times because of this constant issue. I am an ICU RN for over almost 20 years and it has done nothing but to continue to get worse. Last year I coded someone in an ICU for 10 minutes all alone because there was no one to help me. I no longer can sleep because people did not have a fair chance at surviving. It breaks my heart telling family after family their loved one died, especially under my care when I know they may have had a chance of living if staffing was better. I wish everyone could have looked into the eyes of the people I watched died because of unsafe staffing. If legislators looked into the eyes of everyone I have watched died, even in just the last few years, I guarantee you they would also suffer from insomnia and PTSD. One day you could be laying in an ICU bed, and I bet you don't want to hear that your RN has 4 other intubated patients trying to die. That's not what my patients want to hear either. Thank you.
Hello, Chair Rogers and committee members. First, let me give honor to God, who is head of my life. Thank you for your time today. My name is Carolyn Clemens, and I'm a registered nurse in Grand Blanc area. I am also a leader in my local union, Teamster 332, which supports all 3 parts of this legislation. I am a member of the State Board of Nursing, although I'm not here in that capacity today. I have been a registered nurse for more than 2 decades. I currently work in the special care nursery with fragile newborns. I also have over 18 and a half years of experience in medical intensive care unit. Nursing is a tough job, and we all accept that. However, hospitals are making it even tougher than ever to do our jobs. I worked throughout the pandemic where we lost valuable family members, but nothing was more devastating than when we lost 52 people in 30 days. That was my breaking point. Upon arrival the next day, I sat in my car crying and shaking, not wanting to go to work. It was not the pandemic and death per se, although that definitely took its toll. It was more the fact that I didn't feel supported by my administration. Understaffing started before the pandemic, continued through it, and continues today. We are often scheduled short with no plan. I have been left as the only specially trained nurse to take care of 8 babies on the unit, 8 fragile newborns. These are babies that may be on ventilators, have chest tubes, have IVs. They have complex special needs to keep them alive. This is someone's child. I think of my own grandchild being that vulnerable, and it makes me sad and angry. There is serious risk to the babies, and there is unbelievable stress for me, trying to monitor and take care of all of these children. The trauma that this causes me and other nurses is hard to measure, but we feel it every day. My frustration is that administration is not planning properly for our staffing needs so that we can actually do our jobs and keep these little babies safe and get them healthy. That's why we need a law that establishes safe limits on patient assignments so that nurses aren't sitting in their cars crying, wanting to go into work, or quitting and leaving nursing altogether due to making difficult decisions about who gets care and who has to wait. So please, we need your support to support us so we can support our communities. Thank you for allowing me to share my thoughts on the Safe Patient Care Act.
Thank you, Chair Roberts and committee members. My name's Nikia Parker. I came down from Wexford County today for this hearing. I've worked as a registered nurse in the emergency department of a Northwest Michigan hospital in one capacity or another since 2005. But I also have experience working in various hospitals across the state, from rural access hospitals to large teaching hospitals, as well as experience working in California, where nurse-to-patient ratios are legislated. Over a year ago, I made the really difficult decision to walk away from the career I feel I was put on this earth to do, and that is bedside emergency room nursing. It's the thing that defines me most, aside from being a mother. At the core of what we do as nurses is advocate for our patients, all patients, to make sure that they leave us a little better than when they came to us. So when you go home after 12, 16, or more hour shift and you can't sleep because all you are thinking about is, did I miss something? Did I forget that? Did someone get hurt because of the care I provided? Or worse, because of the care I wasn't able to provide? Or God forbid, did someone die because of something I didn't or couldn't do? The moral injury eats at you. It kills you a little bit every day to the point that you become paralyzed in fear for doing your job. 10 years ago, my 17-year-old cousin Owen died in my emergency department. I was working that day, and I watched a highly trained, experienced, and robustly staffed team of my work family give him every possible chance at survival. His death was tragic, but I have peace. Peace knowing that understaffing and nursing resource rationing did not contribute to his death. This year, I lost a friend. He also died in the hospital in which I work after multiple encounters with both outpatient and inpatient facilities. I know there were times that he was cared for by nurses pulling far more weight than is safe, nurses forced to ration their care, and inexperienced nurses who lacked support because their experienced coworkers were also drowning. I will always wonder how much that contributed to his outcome. I will never have peace in his death, and it will haunt me and likely the people that cared for him for the rest of our lives. Situations like this broke me. The moral injury became too much. I made the decision to take a 50% pay cut to leave bedside nursing and become a paramedic full-time. I still work 1 day a week in the emergency department because despite the abusive environment, I just can't bring myself to completely walk away from the community I deeply care about when they are at their most vulnerable. But so many of my coworkers have left due to moral injury, and we are burning out the few new nurses that we can convince to join the fight. I am an example of how there is no shortage of available nurses. 50,000, according to Lara and the Bureau of Statistics, that are registered nurses licensed to work in the state who are not choosing to work here. If the Safe Patient Care Act is passed and we have ratios, I'm one of those nurses who would return to the bedside full time, and so many of my coworkers that have left would join me. Please stand up for the nurses that are here, the nurses that couldn't be here because they're working, and the people of this state who deserve the best possible care.
Good afternoon. My name is Rachel Hunt. I'm a registered nurse, and I became a nurse to care for people on what could be one of the most difficult days of their lives. My patients are more than just a room number to me. They are humans that deserve to be treated with dignity and respect. I've had the opportunity to also travel around Michigan and work in several hospitals throughout our state, both union and non-union. This experience has allowed me to gain insight into one thing our Michigan hospitals have in common, and that is substandard working conditions. And this has endangered the patients and our healthcare workers. And this is specifically due to unsafe nurse-to-patient ratios. This puts nurses in situations where we are forced to prioritize the care of our patients throughout our entire shift. Nurses should not have to choose if we are going to pass urgently needed medications or if we're going to change our patients who have been sitting in their urine and feces for hours, and I mean hours.
I'm sorry to interrupt. We do have 4 minutes left, and I know you have someone that wants to testify with a personal story.
Patients shouldn't be left with life-altering disabilities due to a stroke that could possibly have been prevented that were caught in time with life-saving medications. My Christmas shouldn't be ruined by the what-ifs of a patient that went into respiratory arrest. The real question should be, why are my fellow nurses and I constantly caring for critically ill patients in high ratios? Sometimes up to 11 patients per nurse. This isn't new. This has been going on for many years. And since no one is listening, nurses are leaving. We are losing our older nurses with wisdom and our newer nurses who are overwhelmed and overburdened. I am one of those nurses who has left. It's demoralizing to leave every single shift knowing I cannot possibly provide the care patients deserve that I am trained to give. And I would also come back if this bill passes. So,
Thank you. We're going to pause the timer a second, switch out, and then I think we have Mr. Tim Lillard with a personal story. Welcome to Health Policy, and begin when you're ready.
My name is Tim Lillard. I'm not a nurse. I don't work for healthcare. I'm a police officer. Last October, both my wife and I, her name's Ann, we got COVID. It was pretty mild and we were doing good. But I watched her health decline and she required.
I'm so sorry. Can you turn your microphone on? Just the red button.
Oh,
Thank you.
I'm sorry.
That's okay. Just continue.
Her health decline required hospitalization. Over the course of the next 3 weeks, I watched her health go up and down. She had endless IVs. Medications and went into ICU. During her time there, I spent every day with her, often for more than 12 hours at a time. I was really very familiar with her care and observed how few nurses were working. After she went through, turned to the better, and quickly declined again, we were told that she may not make it through the day. After updating my kids, I received a call from the hospital that Ann's heart stopped. But they were able to get her back. And when I got back to the ICU, they were doing CPR. And she died at 12:30. After that time, I tried to understand why she died, because I was told it was from some sort of infection. I got all of her medical records, talked to the nurses and doctors that I know to try and understand why she died. And every time I talked to somebody, said she died from sepsis. Every year, more than 270,000 people die of sepsis, and it's largely avoidable. The deaths, just if there's enough nurses. When I was in the hospital with her, I saw how understaffed it was. In fact, one day it was so bad I even said something to one of the nurses. Nurses need adequate time to catch these subtle changes because it mimics COVID and the flu. It's my belief, had there been nurses adequately staffed, the subtle changes in her health would have been caught and she'd still be alive.
Thank you, Mr. Lillard, for that difficult testimony. If you have any final sentences you wanted to wrap up with.
I do. It's my mission to support the Patient Care Act, Safe Patient Care Act, even before finding out about it. Unless you've had a loved one go through this, you simply can't understand the heartbreak we've endured. Please take action so that no other person or other family endure this loss. You can make a difference in saving lives. Thank you.